Good morning. I'm Nicole Edwards with the NIOSH Office of Research Integration. On behalf of NIOSH, welcome to the second installment of the 2024 Expanding Research Partnerships webinar series. The series theme is exploring worker safety and health in unique environments and challenging working conditions. Today's webinar will focus on protecting the mental health of offshore workers. Now it is my pleasure to introduce Dr. Jessica Streit, Deputy Director of the NIOSH Office of Research Integration.
Thanks, Nicole, and thank you everyone for joining us for today's webinar. We're very pleased to have this opportunity to bring together experts from the occupational safety and health research community who are going to provide critical insights into the successes, challenges, gaps, and needs related to protecting and promoting the mental health of offshore workers. It's my pleasure to kick off the morning by introducing that distinguished panel of speakers. First, we have Dr. Samantha Case, who has studied risk factors for injuries, fatalities, and vessel casualties in commercial fishing, offshore seafood processing, and marine transportation at NIOSH since 2014. Just last week, Sam transitioned from her role as a research epidemiologist at NIOSH to begin a new position as a scientific program official in CDC's National Center for Injury Prevention and Control, and we certainly wish her all the best in this new endeavor. Today, we're very lucky to have Sam with us to share work she completed during her time with the NIOSH Center for Maritime Safety and Health Studies. Dr. Marissa Baker is Assistant Professor in the Department of Environmental and Occupational Health Sciences at the University of Washington School of Public Health. She also serves as Deputy Director of the Northwest Center for Occupational Health and Safety. And today, Marissa will discuss the results of research conducted during the COVID-19 pandemic to identify stressors and solutions related to the mental health of U.S. mariners. Dr. Julie Sorensen is the director of the Northeast Center for Health and Safety, a program of the Bassett Healthcare Network in Cooperstown, New York. Julie's research interests include qualitative research methods, social marketing, intervention development, intervention dissemination, and human behavior research. She has been working with fishermen for over a decade on developing health and safety interventions that respond to the unique needs of fishing communities. And joining Julie is Dr. Mandy Rome, a research scientist at the Northeast Center for Occupational Health and Safety. Her research interests include qualitative research methods, infectious disease transmission dynamics, intervention development, and human behavioral health. She has worked with fishermen for the last 6 years on developing health and safety programs to address their community's needs. Together, Julie and Mandy will provide a global perspective on mental health in commercial fisheries and discuss mental health resources for the fishing industry. And now we're ready to begin our webinar. Approximately 40 minutes of presentation from our speakers will be followed by an interactive question and answer session. Please put any questions that you have for the speakers in the Q&A box at the bottom of your screen at any time during the webinar. And without further delay, I will invite Dr. Sam Case to our virtual podium to get us started today. Sam?
Thanks, Jessica. Hi, everyone. Thanks so much for joining us today. I'll be kicking us off with an introduction to work-related stressors in maritime. So first, what is the relationship between work and mental health? Work is a social determinant of health that can influence many aspects of our lives, both positively and negatively. It is an important protector of mental health. Work can provide a livelihood, a sense of confidence, purpose, and achievement, positive relationships, and a sense of inclusion and belonging, all of which are amplified in a safe and healthy work environment. But work can also negatively affect mental health. And there are many different reasons for this, some of which we'll talk through today. But the mental health and behavioral health effects of work-related stressors are many. And these effects include depression, anxiety, burnout, fatigue, and substance use. And workplace stress and poor mental health outcomes have wide-ranging effects that span beyond individual workers. Chronic workplace stress can lead to lower job satisfaction, morale, and productivity among workers, as they may feel less energized and motivated. It can also harm retention efforts and lead to high turnover as workers strive to find better working conditions. And finally, it can lead to an increase in workplace incidents, such as injuries, because workers who are stressed or fatigued may be less likely to recognize and avoid hazards. Maritime work environments are incredibly diverse, taking place on the water, as you might expect, as well as waterfront facilities. Maritime jobs include vessel-based work, such as in marine transportation and commercial fishing, as well as land-based work in ports and marine terminals, shipyards, and seafood processing plants. But today we're going to focus on the offshore segments of maritime, including commercial fishing and marine transportation. Briefly, commercial fishing involves the harvesting of fish and shellfish from wild stocks using a variety of vessels and gear, such as lines, nets, and traps. Marine transportation is the movement of goods and people using a variety of watercraft, such as ferries, cruise ships, container ships, oil tankers, towboats, and more. And as you can see from these images, there's just a small sample of 4 vessels of a variety of sizes and configurations. They also differ in how and where they operate. Vessels may have a single crew member on board to hundreds of crew consisting of captains, mates, deckhands, engineers, cooks, and more. Within each of these industries, the operations and the organization of work can vary greatly. But there are general work-related stressors shared by these workers that can affect their mental health and well-being. And these stressors, as you'll come to learn, are often very interrelated. So let's get into it. First, maritime workers can experience or witness severe life-changing injuries that can have profound effects on these workers' psychological well-being. Workers are exposed to numerous physical, ergonomic, and chemical hazards, such as noise, vibration, working with dangerous machinery and gear, slippery walkways and ladders, exposure to chemical cargoes, and lifting heavy objects, just to name a few. They can also work in extreme environmental conditions, including wind, waves, and icing conditions. And all of these can affect anything from slips, trips, and falls to vessel sinkings. And because of these hazards, maritime workers experience higher rates of fatalities and non-fatal injuries than workers in other jobs. Studies have shown that maritime workers are concerned about their safety working on board vessels and perceive their work as unsafe at higher levels than workers in other jobs. One study revealed that about 2/3 of mariners were stressed about ship safety, and this was linked to physical and mental fatigue, sleepiness, and job dissatisfaction. Risk of injury and mental health outcomes are also correlated among maritime workers. For instance, a survey of mariners found that those with depression, anxiety, or suicidal ideation had increased likelihood of a work-related injury. Factors related to work organization can also have significant effects on worker mental health and well-being. Many maritime operations are characterized by round-the-clock, 24/7 operations, and this requires shift work and sometimes very long working hours. This can vary depending on the vessel and operation type and the crew on board, but often leads to less sleep than is desirable. On towing vessels, for example, watch-keeping schedules are often 6 hours on, 6 hours off, or 12 hours on, 12 hours off. In the fishing industry, commercial fishermen may work for 16 to 20 hours a day during the peak harvest times within a fishing season. The work hours for maritime workers may result in stress, fatigue, tension among the crew, and impaired human performance. Non-standard work arrangements are also found in maritime industries, such as contracts. Mariners on temporary contracts have reported an increased prevalence of work stress, depression, and fatigue due to scheduling uncertainty and just an overall sense of job insecurity. Many commercial fishermen are independent contractors, which can impact their access to safety and health protections and employment benefits such as healthcare coverage. Job control, or the ability to make and influence decisions about work, can mitigate stress caused by high demands at work. But when demands are high and control is low, that translates to a high-strain job. And maritime work is often characterized by high job demands and low job control. Mariners have reported that their high-pressure work is a leading work-related stressor that has been linked to fatigue, job dissatisfaction, and intent to leave the industry. Many mariners also report a lack of autonomy, which has been associated with chronic fatigue and sleep issues. Low job control can be due to the hierarchical structures on vessels. So, for instance, a captain holds the power and authority over the vessel and all the crew. But this can also be due to external factors, which we'll talk about in a moment. Offshore work is very unique because these workers live where they work, at least temporarily. And there are numerous stressors when we think about working and living on a vessel. The time on board varies by operation. Workers may be on vessels for months at a time with limited shore leave. Extended time at sea has been linked to job dissatisfaction among mariners. Studies have shown that for seafarers, mental health significantly decreased after a long voyage and led to symptoms like anxiety and paranoia. Commercial fishermen have also reported feeling isolated and lonely, even when they're working on a vessel with other crew members. And this social isolation is a risk factor for depression. You saw images earlier in this presentation of some of the vessels used in maritime operations, and some are much smaller than others. Even on the largest vessels, crew may feel restricted living on a vessel. And this is only exacerbated on those smaller vessels where there are close living quarters, a lack of personal space, and limited mobility. Social support is a protective factor for mental health and well-being. However, when at sea, communications with friends and family at home can be difficult. Satellite internet is gaining more traction in maritime industries, but it's not ubiquitous. Internet access can be limited, and even when it is available, it can be costly to maritime workers. The isolation and the remoteness of this work, as well as some monotonous and routine work, can lead to feelings of boredom among crew. And this can lead to stress as well as safety problems through lapses in attention. And we've discussed how the quantity of sleep may be limited on vessels, but the quality of sleep is also impacted. Sleep disturbances can be caused by vessel motion, vibrations, noise, and light. Poor sleep among mariners has been linked to poor mental health outcomes, including depression and emotional exhaustion, as well as fatigue. Positive interpersonal relations among crew members, lending to social support and cohesion, can be a protective factor against adverse psychological effects, as we've kind of alluded to previously. However, mariners have reported a range of negative interpersonal issues and workplace violence. OSHA defines workplace violence as, quote, any act or threat of physical violence, harassment, intimidation, or other threatening, disruptive behavior that occurs at the worksite. Mariners have reported multiple types of workplace violence, including hazing, bullying, harassment, assault, sexual harassment, and sexual assault. And women in maritime are disproportionately affected and have reported higher rates of harassment and sexual-based violence. Regardless of gender, these experiences can lead to increased stress, anxiety, depression, and post-traumatic stress disorder, or PTSD, among crew members. There are also stressors related to external factors like policy and economic concerns. And these broader contexts influence maritime operations and impact workers' sense of job control and decision-making authority. Maritime workers may feel stress from complex or unclear regulations. For example, the commercial fishing industry is governed in part by a fisheries management process, which affects how, where, and when fishermen can work. And fishermen have expressed that the increased complexity of these rules and regulations has significant impacts on their levels of work-related stress. As another example, mariners who work in international shipping have reported stress related to confusing international regulations pertaining to shore leave. Unpredictable market prices, the state of local and global economies, and the state of international trade can also affect stress. In one study of mariners, 90% of participants indicated that global trade and economy concerns were a main source of work-related stress during the COVID-19 pandemic. As mentioned in the very beginning, work provides a livelihood and a sense of safety and security. And threats to this livelihood and income because of uncertainty about future work is a major stressor for maritime workers. From climate change affecting the health of fish stocks to supply chain disruptions from external forces, there are many factors at play that can impact whether these workers have sustainable, reliable work into the future. So now that we've reviewed some significant stressors at a very high level associated with offshore maritime work, what do we know about the mental health status of maritime workers? And given this really unique work environment, what culturally appropriate interventions can help protect the well-being of maritime workers? Dr. Baker, Dr. Sorensen, and Dr. Rome will discuss the answers to these questions next. And I have some references in case anyone wants to dig into any of these topics a little more. And as Jessica mentioned, I was with the NIOSH Center for Maritime Safety and Health Studies, and I've provided contact information here if you have questions or want to learn more. Thank you so much.
Thanks, Sam, for orienting us all to the topic of the day by providing that overview of work-related stressors that are faced by maritime workers. Next up, we'll hear about post-pandemic mariner mental health from Marissa Baker. Marissa?
Hi, thank you. So I want to talk about some of the results from the U.S. Mariner Survey that I did with all of the great partners who are highlighted here. This was during the first half of 2021, so right during the height of the pandemic. March 2021 was when vaccines became widely available, just to kind of orient ourselves to that time. And the goal of this survey was to characterize mental health outcomes, potential causes, and barriers to accessing mental health care in U.S. mariners. So the mariners who transport goods, not fishermen. And to prioritize interventions to improve mariner well-being, not only during COVID-19, but beyond. So in brief, nearly 1,600 mariners responded, and they tended to be white male between the ages of 25 and 64. This does reflect the industry as a whole, but of course it makes it harder for us to make inferences about some of the underrepresented groups. Mariners self-reported to be in good physical health. They like their jobs. They like the people they work with. I'll show some stats on that in a second. But during the pandemic, and they did feel like they were lacking support both from the shore side and from their crews, and they could feel isolated when they were at sea. They also reported that their sleep quality and mental health decreased. It got worse during the pandemic, as it did for all of us probably as well. But just to start with some big positive news, we asked the mariners, do you agree with these statements? I like the people I work with, and 91% of our respondents either agreed or strongly agreed that they like the people they work with. When we asked if they like doing the things they do at work, 93% agreed or strongly agreed that they do. And so this points to kind of what Sam said around the positive aspects of work. Mariners like their job, they like the people they work with. And so, despite that, we still saw adverse mental health outcomes. And here are the mental health outcomes that we saw in this survey population. So we used validated screeners to assess 5 different outcomes, and those are listed along the x-axis: depression, anxiety, suicidal ideation, high stress, and PTSD. And you can see the percentage of mariners that screened positive for these adverse mental health outcomes. About 21% would screen positive for depression, close to 10% for had suicidal thoughts in the previous 2 weeks. And then if you look all the way onto the right, more than half of the respondents to our survey had at least one of these 5 outcomes. Now, there could be a selection bias at play here, right? Because the people who are more likely to take a mental health survey maybe are folks who feel like they are struggling with their mental health. But when I presented these results to the industry groups that I worked with, this certainly set off some alarms. These numbers were much higher than they expected to see, especially considering this is such a mentally fit occupation and an occupation that requires a high degree of mental fitness to be successful, given the hazards that Sam summarized for us. So we looked a little bit at what aspects of vessel life were related to the mental health outcomes in our survey. You can see we have a paper detailing this in more detail, which I've linked below. But consistent with what Sam told us, those who had longer afloat tours tended to be related to adverse mental health outcomes. Those who expressed that they had more worries about what was happening at home or were feeling more isolated. The frequent changes in protocols that were happening during COVID-19 were related to adverse mental health outcomes. Those who said they received limited communication from their company or their union around mental health. Those who said they could not access mental health care both either on the vessel or off the vessel. Those who felt a lack of support or community on the vessel. And we really saw a strong relationship between poor sleep and mental health outcomes. For a variety of different kind of things that mariners experienced, we asked them how often they experienced these during COVID-19. And so what I present here are the percent of respondents to our survey who indicated that they have these experiences either fairly often or very often. And along the x-axis, I have the different experiences with the percent who responded. So nearly half of our mariners were denied shore leave in port. And of course, this was part of a COVID-19 protocol, but it really did wear on their mental health. About a third felt isolated on board a vessel. About a third were also restricted in their ability to join or rejoin their family. And then getting kind of access to the home front, 27.5% indicated they have inadequate cell phone service, and more than that, 36% indicated they have inadequate internet access on a vessel. So this was a situation of folks who were denied shore leave, were at sea for longer periods of time, unable to join their family, and also lacking access to cell phones or internet to communicate with the home front. So I mentioned that paper that really kind of summarizes things for COVID-19, but another, I think it's important to also take these findings and try to move them, now that we're past the immediate threat of COVID-19 and many of the protocols are returning to normal aboard the vessels, to kind of pull out some of the findings from the survey that could be timeless and also could inform the industry post-COVID. And so in addition to the quantitative results that I presented, we also had some qualitative questions on the survey. And so we did kind of a content analysis to identify some themes that could inform the industry moving forward. And I'm going to highlight some of those in my time today. So the first is the need for better mental health communication to mariners. 65% of our respondents reported that they received no communication or training on mental health during the pandemic from their employer. And one of the mariners told me, mental health training the company sends out is not helpful at all, as it does not pertain to mariners. In one of the trainings, some of the tools they suggest to help with mental stress are talk to your family or go outside for a walk. So what we found is that while most mariners did not receive anything or reported they did not receive anything, even those that did, it might not have been appropriate to the mariner audience. And these are the topics that mariners indicated they would like to receive some training or communication on: warning signs to look for in crewmates, how to access mental health help, the access and protections they have through their employer, who to contact if they have needs while they are aboard, and strategies to cope with stress were the top 5 topics that mariners were interested in learning more about. The second theme was related to protocol changes and unfair application of the protocols. So in our content analysis, we learned some mariners appreciated all the protections, the masking, quarantining, things like that. Others hated it, kind of like the general population. But what was consistent is that the mariners felt that the protocol changes, they weren't getting a lot of communication around them. It didn't seem like they were justly applied either within the organization or between organizations. And so that, regardless of whether they found them helpful or harmful or annoying, they pretty much all agreed that the way they were rolled out was not supportive of mental health. And one mariner told me, "During my last trip, we had an extended port stay for maintenance and were restricted to the ship for our safety. Despite crew members not being allowed to leave, our ship was overrun by contractors who could come and go as they please. The companies preached safety and following the rules, yet they allowed a person with a positive COVID test to come aboard the ship. The rules only apply to the companies when it is in their interests, and our freedoms have been stripped from us out at sea for what seems like no reason. Things like this really wear on a seaman's mental health." This was actually one of the most common things that we heard, when shoreside people don't have to follow the protocols, or when stevedores could get on the vessels without following the protocols. It did not please the mariners who were kind of forced to be following protocols. We also learned that barriers exist to accessing mental health care, especially for the mariners who may need it the most. Nearly 70% of respondents to our survey said they would not be able to start or maintain mental health care while aboard a vessel. And you can imagine, with lack of internet, lack of phone, you can imagine why that might be challenging. One mariner told us, "Mental health care is a literal joke on board. There are no accommodations made while on board. Even when management explicitly states that mental health care accommodations should and will be made, it is made clear by senior officers that any request will be denied and seen as negative behavior." So there's not only kind of the access issues due to accessing a provider, but there can also be kind of stressors from those that they are working with on the vessels to feel like they're discouraged in accessing care. So we asked the mariners, "Do you agree or disagree that vessel senior officers encourage the crew to get mental health help if needed?" And for those mariners who screened as not having depression, 70% agreed that they are being encouraged to access mental health help. But for those mariners who screened positive for depression, less than half agreed that they are being encouraged to access mental health help. So this tells me that mariners with depression are much less likely to feel supported by senior officers. And these are in fact the mariners who would need this help the most. Similar, we asked, do you agree that if you're feeling sad or stressed, there is usually someone on the vessel to talk to? Among those mariners who are not depressed, my things are off a little here. Among those mariners who are not depressed, which is on the left, more than half agreed that there is someone on the vessel to talk to. 56% agreed. Among those mariners who screened positive for depression, only about a third agreed that there is someone on the vessel to talk to. So again, mariners with depression are much less likely to identify someone to talk to. And as Sam told us, social support is an important kind of protective factor for mental health. And so, making sure that everyone has someone to talk to, especially those who might need it the most. And one mariner said there is a stigma with asking for mental health help in the industry. It is largely an attitude to forget your problems and work through it. Focus on your duties and forget how you feel. There really are no resources available for mental health for commercial mariners at sea. It has made me seek shoreside employment and not want to return to sea until a solution is reached. Sailing during COVID was the only time in my life I've truly experienced hopelessness. And here are the most common barriers that were given to me for accessing mental health care. Most common was lack of consistent internet and phone, but I also want to highlight that there were concerns about losing their U.S. Coast Guard credential, and concerns around not having privacy or just not wanting to spend the time when they have such limited off time. This is the last theme I'm going to highlight for you all. Mariners appreciate support and recognition from their employer and the public for the critical services they provide. And they feel like they did not have this during COVID. They weren't, on the priority list for vaccinations like our healthcare workers were, or, military. One mariner told me that mariners feel like numbers on a spreadsheet, pushed around to get the mission done, not people with lives of their own. We understand that it is a difficult time, but a little outreach from the shoreside office would go a long way. So some more recognition moving forward. And at times like these, the maritime professionals know for sure that our country doesn't care about the risks we are taking and continue to take to get critical products so that the country can operate. Our workforce isn't as large as most, but we are treated like criminals in our own ports and have no access to vaccines, although we are forced to have repeated contact with people who have been exposed to COVID. A lot of us do not need to be out here. We do it for the honor involved in providing a critical service. Obviously, we need better lobbyists. So this is recognition not only from shoreside, but also from the country, and appreciating the work and service that they provided all of us to keep us safe during the pandemic. So the recommendations I have, and these are kind of for moving into this past the immediate threat of COVID era, to continue to increase screening for mental illness, because we did find that the rates were higher than we expected. Appropriate and frequent training and communication around mental health and sleep hygiene. I didn't talk about the latter, but that was important in the survey as well. Coming up with mental health care and wellness resources that can be accessed aboard a vessel, sometimes without internet access or telephone. Increasing social support on board. Half of the respondents said they don't have someone on the vessel to talk to. So whether this could be some kind of mentorship program or someone on the vessel who is kind of known as the resource if you need someone to talk to. I also want to emphasize that more supports are needed for women and younger mariners. Both of these groups had higher rates of the 5 mental health outcomes as compared to the overall population. And if we want to continue growing this occupation, which we need to, we do have to make sure that we are supporting all mariners and making sure that they can enter and stay in the field. So I will end with my disclosure slide. This was funded by CDC NIOSH via an IPA to myself. And the results here reflect my view and not the view of others.
Thanks, Marissa, so much for sharing the insights that you've gained by engaging with mariners to learn more about their work experiences and their mental health concerns. I'd now like to invite Julie Sorensen and Mandy Rome to our virtual podium to deliver our last presentation for today, which will cover mental health in commercial fisheries. Julie and Mandy, thanks for being with us today.
All right. Thank you, Jessica. And thank you, Marissa, for that very informative presentation. I think you'll probably see similar themes in our presentation today, which, as Jessica pointed out, will focus on mental health in commercial fisheries, and we'll be sharing our experiences working with fishermen in the Northeast. And I'll be joined by my colleague, Dr. Mandy Rome, who will talk about a project that she led and several resources she's pulled together to support commercial fishermen in their mental health needs. I think just to give you a quick overview of our 15 minutes, I'll talk a little bit about who we are, the Northeast Center, and give a quick overview of Northeast fisheries. We'll give a bit of an overview on mental health concerns in Northeast fisheries, and then a quick look at the literature globally. And then my colleague, Dr. Rome, will talk about her man therapy campaign and then resources that we have offered or are sharing with fishermen on our website. So the Northeast Center for Occupational Health and Safety will give a quick overview on who we are and what we do. Our mission at the Northeast Center is to enhance the health of ag, forestry, and fishing workers. And we do that by identifying priority health and safety issues. We work with these communities and stakeholders to develop prevention solutions collectively. So we co-create solutions, and we are one of 11 regional NIOSH extramural ag, forestry, and fishing centers. A quick look at Northeast U.S. fisheries. In our neck of the woods, commercial fisheries operations tends to be smaller businesses. Many are one-man operations, or they may have just a few crew members. And I will note that anecdotally, we've observed an increase in one-man operations. And there's a variety of reasons for that, which probably we don't have time to get into in this presentation. We do have some larger offshore fleets, but mostly these are smaller fisheries operations. And as you can imagine, commercial fisheries are one of the most dangerous occupations, second only to logging in relation to the rate of occupational fatalities. Fishermen, more specifically, are 38 times more likely to die at work, and there are many reasons for this. Falls overboard are the leading cause of death in the Northeast lobster fishery, which is big fishery in our region. Vessel disasters are the biggest contributors nationally to the commercial fisheries industry death toll. There are also accidents that are related to slips, trips, and falls, and that can be problematic when you're out at sea. There are also onshore injuries that occur. And I think one of the things that we've been increasingly concerned about are the issues related to financial stressors, regulation, past trauma, social isolation, being away from families, many of the things that Dr. Case has already mentioned. I will note that we did a study on sleep and health in several regions of the United States with commercial fisheries and found that regulation was one of the biggest reasons that they were losing sleep. Another thing that we have noted is the issue of solastalgia, which is interesting term, but it really relates to being at home, but not feeling at home because your home has changed so much. And with rapid changes in the working waterfront, that seems to be an increasing concern for fishermen. And just to look at the literature a little bit and how this topic is being covered by the research, occupational safety and health research community collectively, we'll note that despite the fact that fishers are susceptible to a range of mental health issues that are linked to the nature of their work and factors outside of work, it is interesting to note that there are a few studies who have really looked specifically at mental health. And interestingly, this chart here shows studies that have been focused on various topics globally as well. And you can see mental health is represented in these pie charts with the brown slice of the pie chart. And you don't see a lot of brown there, kind of reflecting the fact that there's probably a lack of research in this area. I think the studies that have been conducted, they have looked at issues such as fishing access restrictions or large-scale environmental destruction and the long-term ramifications for fishing families. And then, in the literature, there has been discussion of the rates of suicide in commercial fishing communities, which are unacceptably high, I would say. We have roughly 48 deaths per 100,000 fishermen, and specifically for males. And we did a study, actually the sleep study that I referred to, where we provided health assessments for fishermen, and we used a clinical PTSD screener. And what we found is that the participants in our study, if you just focus on the male members in our study sample, their rates of PTSD were 3 times higher than what you'd see for the national average for men. So much, much higher in the commercial fishing industry. I think what concerns that we have are that if there are that many fishermen who are struggling, can they get access to mental health care? And not surprisingly, this is very difficult. And there are various reasons for this, getting time off from work can be very difficult. And when you take time off, you lose money. So not something that they enjoy doing or want to do because they need the money. Their schedules are dictated by the weather, and they will be the first to point out that they aren't good planners when it comes to their own health. And another issue is that, if you go to the doctors, you want to make sure that that experience is a good experience, or, fishermen may not return. And there are some concerns about cultural competency in the provider community. Do they know how to have conversations with fishermen about their health? And are they aware of the limitations fishermen experience when it comes to taking care of their own health? And then there's also the stigma of help seeking. So given that background, I will now turn things over to my colleague, Dr. Rome.
Thanks, Julie. So I want to talk today about the Man Therapy campaign that we did. So we teamed up with the Maine Coast Fishermen's Association. Monique Coombs is their director of community programs. So she had come to us with this idea, and we teamed up with Man Therapy. So they are a group that focuses on destigmatizing mental health seeking behavior. And this is an approach that the fishing community had recommended for us. So if anybody has seen the TV show Parks and Recreation, Man Therapy kind of takes that vibe. So they sort of have this comedic take on tackling very serious issues. So this is a way to sort of get those difficult conversations started. There are a lot of issues in seeking mental health care, stigma being a huge one for not only fishermen, but a lot of other people as well. And Man Therapy, it's not just for men, it is also for anyone that has a man in their life. So this is a great resource for fishermen's wives, fishermen's children, fishermen's parents, whoever is in their life. So using local vernacular was really important. We wanted to develop this outreach material for fishermen and organizations that work with fishermen and so on. But using local vernacular was a really important part of this. I'm not going to go through this whole list, don't worry. But using language that connects with the population that you're trying to target is really, really important. It's going to grab their attention, and it's going to help them relate to the content that you're trying to get across. It shows that it's made by somebody that understands their lifestyle. So we wanted to make sure that these outreach posters, social media posts, things like that, all got their attention and spoke in a language that they typically speak in. So these are 3 of the posters. Man Therapy has an incredibly talented team. We, MCFA and the NEC, we had a few meetings with them to discuss commercial fishing and what it means to be a commercial fisherman, what their lifestyle is like. And from those talks, Man Therapy designed 7 posters to destigmatize mental health seeking behavior and to get fishermen thinking and talking about this subject. Speaking of using local vernacular, this first poster on the left, "Get that mind of yours running on the flat ass calm." This is a phrase our fishermen here in the Northeast use a lot to describe a very calm ocean, perfect fishing conditions, the kind of day you want. So we thought this was a great use of that and something that would really grab their attention and get them sort of engaged in this material. The second poster here, "The ocean keeps you mostly sane. Man Therapy can help with the rest." This shows fishermen that there are resources for them, and we'll get into those in just a little while. And the last one, "Don't let your brain be the only equipment that you don't maintain." Fishermen pay a lot of attention to their equipment. It's really, really hard. It's really important for them to maintain their equipment, make sure everything is running right, doing what it's supposed to do for safety reasons. So kind of saying, you maintain your equipment so well, so do the same for yourself. And we've got 3 more here. There are a few more examples. So this middle one here, very much like Man Therapy, kind of taking that humor aspect, but still tackling these serious issues. So give your brain as much attention as you give your dinghy. We also have 2 more, a little more serious, not quite as funny, but therapy won't bring home more fish, but at least you will bring home less baggage. So just kind of, no, it's not going to change how you fish, but it can still help you, sort of thing. And if you can take on the unforgiving North Atlantic, you can take on what's north of your neck. So north of your neck is a common phrase that fishermen use in the Northeast. And everybody knows the North Atlantic is incredibly unforgiving. So just sort of relating back to their job and their lifestyle. So we did, we had these posters done and we said, okay, how do we get them out? We don't want to just share them once on social media and have them gone. Jessica, I just sent you the link to our website, if you wouldn't mind putting that in the chat for me. So we decided to house all of these on a website, but we wanted to be able to kind of have these materials for fishermen, for organizations that help fishermen with different things. So we decided to create a website, so that link went out in the chat. We wanted to make sure we could get everything out there. So we made this website where we can people can download all of these posters, whoever want them. We named it Lines of Support Tackling Stress at Sea. And our whole goal is to gather resources in an easily accessible way to aid fishermen and those working with, living with with fishermen, and get the resources that they need. So like Marissa said in her talk, one of her fishermen had said, we have these mental health resources, we had this training, but the takeaway was, go for a walk, go talk to your family, which these are not feasible. You can't do that when you're out at sea. And a lot of general mental health information, a lot of people say, have you tried fishing? So, you're not going to tell a commercial fisherman that, because they have indeed tried fishing. So that's not going to help them. So we pulled together some resources. We did try to pull out state-specific resources. So the coastal states that our organization covers, we have in here. So if they have fishery-specific mental health resources, we made sure to point that out. We also have some general mental health resources. But like Julie was saying, kind of that cultural competence, I think this is a nationwide problem, but there's high provider turnover. So a lot of these coastal states are getting mental health care providers from these landlocked states that really don't understand the fishing lifestyle, which can be frustrating for a fisherman kind of trying to get help from somebody that really can't understand what their lifestyle is. So we also have some resources. So we did several iterations of this website. So we have, our facts, the PTSD rates are a lot higher in commercial fishermen in our study than the national average. Suicide rates are very high. But what we realized was, hey, wow, this is really negative. We need to have a positive spin on this. So we made sure with all of our facts, we had some accompanying link. So, hey, we're talking about PTSD rates. Okay, how can I prevent trauma from becoming PTSD? So it gives them another resource to go to. And then talking about suicide rates, how can I help somebody that's in crisis? Or what do I do if I'm in crisis? And then I'll flip it back to Julie. I think she's going to talk about some other fisheries efforts that are taking part right now.
Thanks, Mandy. So yeah, just an open invitation for anyone who wants to join our behavioral health and commercial fisheries quarterly call. You can email either myself or Dr. Rome, and we can add you to the listserv. We have another one coming up in November, and that will be with Casey Chosewood from NIOSH. I'm also working with Dr. Lincoln and Casey Elliott on an iFish Innovation Exchange, and for more information on that, please visit the iFish website. And Mandy, I don't know if you could just include that in the chat as well. Dr. Lincoln and Casey Elliott are also working on a special issue for Journal of AgriMed. There may be some more articles coming out on that or on mental health in that. And then we have our Fishing Forward podcast series, which can be accessed through Coastal Roots Radio. SoundCloud has been transferred to SoundCloud. So if you're interested, check it out there. And then I also wanted to note that there was an article out in the New York Times focusing on the use of opioids and fentanyl in the fishing industry. And I think that is it for us.
Well, Mandy, Julie, thank you so much. This has really just been a fantastic set of presentations. On behalf of NIOSH, I'd like to thank all 4 of our speakers once again for sharing their insights into mental health in the world of maritime and offshore work. This concludes the presentation portion of today's webinar.